Hello, Professor Lawrence. My name is Jennifer Anderson, and this is my informative speech on cephalosporins. Throughout history, antibiotics have played a vital role in the medical field. In 3500 BC, the Cimmerian doctors would give patients beer soup mixed with snakeskin and turtle shells. The Babylonian doctors would heal patients' eyes by using ointment made of frog bile and sour milk. And the Greeks used many herbs to heal ailments. All of these natural treatments contained some sort of antibiotic. It wasn't until about 80 years ago when antibiotics took the world by storm. In present day, antibiotics have to outwit the bacteria and keep up the potency of this medication to withstand the effects of newly evolved bacteria. Cephalosporins, like their cousins penicillin, are two of the most commonly used antibiotics. To completely understand the branch of cephalosporins, we need to first understand, number one, what are antibiotics and when was the start of the antibiotic era? What are bacteria and what types are there? And who discovered cephalosporins and what type of antibiotic is it? In 1928, a brilliant Sir Alexander Fleming made one of the world's greatest discoveries, penicillin. Antibiotics can fight bacterial infections such as methicillin-resistant Staphylococcus aureus, also known as MRSA or MRSA. According to the World Net from Princeton University, antibiotics are defined as a chemical substance derivable from a mold or a bacterium that can kill microorganisms and cure bacterial infections. There are two types of antibiotics, bactericidal, which means they kill the bacteria, or bacteriostatic. This antibiotic will stop the growth of bacteria and allow the immune system to deal with the infection. Antibiotics are not effective against the infection caused by viruses. Antibiotics have classifications in which each has been designed to be effective against specific types of bacteria. One of the most important classifications of antibiotics would be the cell wall inhibitors. According to an article published by Pauline Go in 2008, she states, cell wall inhibitors such as beta-lactams, cephalosporins, and glycopeptides block the ability of microorganisms to synthesize their cell walls by inhibiting the synthesis of peptidoglycan. Now that we know about antibiotics, let's take a look at bacteria. Bacteria are classified in several different ways. One way to determine the different types of bacteria is by their color after a particular chemical stain is applied. According to the medical assisting book published by Kier Weiss Krebs and Kelly Arney, in 2008, it states, in 1884, Hans Christian Grimm, a Danish scientist, developed a staining technique called the Gram stain. There's two different types of bacteria. The first one is the gram-positive bacteria. Gram-positive bacteria are slow to develop a resistance towards antibiotics. Gram-positive bacteria can be identified by their blue-purple color after being stained. Gram-negative bacteria have a distinct outer membrane that prevents many drugs from penetrating them, making these bacteria usually more resistant to antibiotics. Gram-negative bacteria can be identified by their pink color after being stained. Cephalosporins. Let's talk about them now, since that's what this report's about. In 1948, an Italian scientist named Giuseppe Brozzu discovered cephalosporins in a sewer off the coast of Sardinia. Cephalosporins are an anti-infective agent used to treat infections occurring in a variety of places in the body. It is the patient's job and responsibility to take these antibiotics as instructed by their doctor, no matter what antibiotic they are getting, so that the bacteria are less likely to build up an immunity to this medication. Cephalosporins are used to treat a different variety of bacterial infections, such as respiratory tract infections, skin infections, urinary tract infections, and sometimes prevent infections before, during, and after surgeries. This antibiotic is used as an alternative for patients with sensitivities to penicillin. And normally how we administer cephalosporins is we can either A, administer it orally by tablet or capsule, or many times they are given parenterally by intramuscular intravenous injection. Of course, the reactions and side effects are diarrhea, hives, rashes, and anaphylactic allergies, which are not very common. In conclusion, I have shown you how antibiotics have played a major role in the medical field with the discovery of penicillin. I've explained what bacteria are and the two types of bacteria. I've explained who discovered cephalosporins and what type of antibiotic it is. And lastly, I've explained the importance of taking antibiotics exactly how that doctor has instructed, because bacteria are getting smarter and smarter every day, and it is getting harder and harder for scientists to find an antibiotic that is strong enough to kill the most lethal bacteria. Thank you.